Are you sure you're applying your glaucoma eye drops correctly? While they're a common treatment for glaucoma, many struggle to get the best results. What if the way you're using them is actually lowering their effectiveness? Glaucoma is a leading cause of vision loss, and proper application of eye drops could be the key to maintaining stable vision and avoiding complications. In this video, we'll walk you through the 5 essential steps for effective glaucoma treatment. By the end, you'll know exactly how to apply your drops for maximum results and better eye health. Stay with us. These steps might just change your approach to glaucoma care. Step 1. Wash your hands first. Before applying your eye drops, there's one step you can't skip: washing your hands. It may seem simple, but it's essential. Even a small amount of bacteria can affect your glaucoma treatment. A 2017 study in the Journal of Glaucoma found that improper handling of medication, like using unwashed hands, can lead to eye infections, which can worsen glaucoma symptoms. You certainly don't want that, especially when maintaining eye health is the goal. To wash your hands properly, use warm water and soap. Scrub for at least 20 seconds. Don't rush it. This step is just as important as the treatment itself. Afterward, dry your hands with a clean towel or let them air dry. Here's a reminder: avoid touching your eyes or the dropper tip with unclean hands, as this can introduce bacteria. If you tend to forget or rush this step, set a reminder on your phone or leave a note near your eye drops to help you remember. And for those with shaky hands or arthritis, a squeeze cap on the bottle can make application easier. It helps control the drops and ensures you're applying the right amount, making your routine smoother. Now that your hands are clean, let's move on to the next step. Step 2. Shake the bottle. With your hands clean, it's time for the next step: shaking the bottle. It might seem small, but shaking is crucial for ensuring your glaucoma eye drops work effectively. Some glaucoma medications need to be well mixed to ensure the correct dosage. If you don't shake it enough, the medication might be unevenly distributed, which can affect its ability to control intraocular pressure, IOP, a key factor in managing glaucoma. Research backs this up. A study in eye and contact lens showed that skipping the shaking step can lead to inconsistent results. Uneven distribution means you might not get the proper dose, ultimately reducing the effectiveness of your treatment. To shake the bottle, hold it firmly and gently shake it. You don't need to shake it aggressively, just enough to mix the liquid evenly. Be sure to follow the instructions for your specific medication, as some may require more shaking than others. Once the bottle is properly shaken, we'll move on to the next step. Step 3. Tilt your head back and pull down your lower eyelid. Now that your hands are clean and the bottle is ready, it's time for the crucial part: applying the eye drops correctly. The key here is getting the right positioning. If you don't position yourself properly, you might waste the medication. Start by tilting your head back slightly. This might feel a bit awkward, but it's important. By tilting your head back, your eyes will face upward, allowing the drops to land in the right place. Without this step, the drops might just roll off your eye and down your cheek, which isn't what you want. Next, gently pull down your lower eyelid to create a small pocket. This pocket allows the drop to stay in place, ensuring the medication stays on your eye long enough to work. Without this, the drops might run off, reducing their effectiveness. One thing to keep in mind: many people instinctively blink or squint after applying the drops. But blinking can push the drops out of your eye, making the medication less effective. After applying the drops, keep your eye relaxed and avoid blinking or squinting. Let the medication absorb properly. Research published in the British Journal of Ophthalmology shows that improper positioning, like not tilting your head back or pulling down the eyelid, can lead to wasted medication or ineffective treatment. So it's clear, getting your positioning right is key. Now that you've got the positioning down, let's move on to the next step. Step 4. Apply the correct amount of drops. Now that you've created the pocket for the drops, it's time to apply the right amount. This step is crucial because too many or too few drops can affect the effectiveness of your treatment. First, remember the goal: apply just 1 drop in each eye unless your doctor advises otherwise. It might seem like more drops will help, but using extra won't make the medication more effective. It could even waste it. Overuse might cause the drops to spill or overflow, And that's the last thing you want when managing glaucoma. Your eye is designed to absorb only a certain amount of medication at a time. Applying the correct amount ensures proper absorption, which helps lower intraocular pressure, IOP, and prevents further damage to your optic nerve. Using too many drops could lead to irritation or side effects, which can make managing glaucoma more difficult. To apply the drop, hold the bottle above your eye without touching the tip to your eye or lashes to keep the medication clean. Gently squeeze the bottle to release one drop into the pocket you created by pulling down your lower eyelid. Avoid squeezing too hard. Just a soft squeeze is all you need. For those with shaky hands or trouble squeezing the bottle, consider using bottles with special droppers that control the flow. If you're not sure, ask your doctor or pharmacist for recommendations. Studies have shown that using the correct amount of drops is essential for controlling glaucoma. A study in ophthalmology and visual science found that both overuse and underuse can lead to poor IOP control, so always stick to the prescribed dosage. Now that you've applied the right amount of drops, it's time for the final step. Step 5. Close your eyes and apply pressure to the corner of your eye. We're almost there, and this next step might seem a little unusual at first, but it's key to making sure your glaucoma eye drops work effectively. After applying the correct amount of drops, close your eyes and apply gentle pressure to the inner corner of your eye, near your nose. It may sound like a lot to remember, but it's a small effort that can make a big difference in your treatment. So, why is this step so important? Closing your eyes for about 1 to 2 minutes after applying the drops helps the medication stay in place, ensuring it has time to be absorbed properly. This boosts its effectiveness, helping lower intraocular pressure, IOP, and protect your optic nerve from further damage. There's another reason for this step. When you close your eyes, it reduces the chance of the medication spilling out. Applying gentle pressure to the tear duct, the small area near the inner corner of your eye, can stop the drops from draining into your nose and throat. This not only keeps the medication where it's needed, but also prevents potential side effects, like a drop in blood pressure or a slow heart rate, which can occur with some glaucoma medications. To apply the pressure correctly, just use your fingertip to gently press the inner corner of your closed eye. There's no need to press hard, just a soft touch. Hold it for about 1 to 2 minutes to allow the medication to absorb and do its job. Research supports this step. A study in the American Journal of Ophthalmology found that this technique improves the effectiveness of the drops and reduces side effects, making glaucoma management more successful. It's a simple step, but it really makes a difference. Now that you've applied the pressure and let the medication settle, you're done for this round of treatment. But before you finish, let's talk about some bonus tips to make your glaucoma management routine even more effective. Bonus tips for effective glaucoma treatment. Now that you've mastered the 5 key steps for applying your glaucoma eye drops, let's look at a few bonus tips to enhance your glaucoma management and improve your eye care routine. These small adjustments will help you stay consistent and boost your long-term success in controlling glaucoma. Tip number 1. Create a consistent routine. Consistency is crucial when it comes to glaucoma treatment. Regularly taking your eye drops is the key to controlling intraocular pressure, IOP, and protecting your vision. To make it easier, set reminders on your phone or keep your eye drops in a visible spot, like next to your toothbrush or morning coffee. You can even link it to a daily habit, like applying drops after your morning walk. The goal is to make it a part of your routine, so you never miss a dose. Tip number 2. Monitor your eye health regularly. Taking your drops isn't enough. You need to keep track of your eye health. Regular checkups with your ophthalmologist are essential, especially for those over 60. Have your eye pressure checked regularly to see how well your treatment is working. If you notice changes in your vision or feel discomfort after applying the drops, reach out to your doctor. Maintaining routine visits and monitoring your eye pressure ensures you're on top of your glaucoma management. Tip number 3. Stay informed about your medication. Educate yourself about the specific glaucoma medication you're using. Each type, like beta blockers, prostaglandin analogs, and alpha agonists, works differently. Knowing how your medication works can help you manage your treatment better. If you're prescribed a new medication, ask your doctor or pharmacist about its potential side effects. For example, prostaglandin analogs help lower eye pressure by increasing fluid outflow from the eye, but they can cause side effects like darkening of the iris. Staying informed lets you be proactive in your care. Tip number 4. Maintain a healthy lifestyle. Lifestyle plays a key role in managing glaucoma. A balanced diet, regular exercise, and stress management can all support your eye health. Regular physical activity helps lower blood pressure, which in turn helps control eye pressure. Eating antioxidant-rich foods, like leafy greens, fish, and nuts, supports overall eye health. And remember to stay hydrated, as proper hydration keeps your eyes functioning well. While these lifestyle factors don't replace medication, they can make your glaucoma treatment more effective over time. Now that you've learned the essential steps for applying your glaucoma eye drops, it's time to put them into action. By washing your hands, shaking the bottle, applying the right amount of drops, and using pressure on the corner of your eye, you're on the right path to more effective treatment. Don't forget those bonus tips. Routine, monitoring your eye health, and staying informed about your medication are just as important. Here's the thing, knowledge is powerful, but action is what makes the difference. Are you ready to take control of your glaucoma treatment and do everything you can to protect your vision? The power is in your hands. If you found this video helpful, give it a like, share it with someone who might benefit, and subscribe for more health tips. Don't forget to turn on notifications so you never miss valuable content that can help you improve your health. And before you go, check out the next video on the screen. Keep learning and taking those small but impactful steps toward better health. Your eyes and your future will thank you.